If you have been dealing with chronic lower back pain for months or even years and nothing seems to fix it, no stretching, no medication, no chiropractic adjustment, no massage, then please stop what you are doing and watch this video completely, because there is a connection between your liver and your lower back that mainstream medicine almost never talks about. And if your liver is sluggish, inflamed, or overloaded with toxins right now, it is sending pain signals directly into your lower back every single day. And the pain will keep coming back until you fix the real source. And here is what makes this even more shocking. There is an organ sitting inside your body right now that could be the true hidden cause of your chronic lower back pain. It is not your spine. It is not a herniated disc. It is not your kidneys. It is your liver. And here is what most people never realize. Your liver has no pain receptors of its own. So when it is struggling, when it is inflamed, when it is overloaded with toxins and processed foods and medications, it cannot tell you directly. Instead, it sends that pain somewhere else. And for millions of people across America, that somewhere else is the lower back. Today, I am going to show you exactly how this connection works, what the warning signs are, and what you can start doing about it beginning tonight. And if you are new here, welcome to the channel. Hit that subscribe button right now, because every single week we bring you honest, research-backed, and genuinely life-changing health information that your doctor probably never had time to explain to you. This community is growing fast, and I do not want you to miss a single video. Now let us get deep into this, because what I am about to share could completely change your understanding of chronic pain forever. Let us start with the basics, because before we can understand the connection, we need to understand what the liver actually does. And most people are genuinely shocked when they learn just how many critical functions this one organ is responsible for. Your liver is the second largest organ in your entire body, sitting just beneath your rib cage on the right side of your abdomen. It performs over 500 different functions every single day. 500. It filters your blood and removes toxins, bacteria, and waste products. It produces bile, which is essential for breaking down and absorbing dietary fats. It regulates blood sugar levels by storing and releasing glucose as your body needs it. It metabolizes medications, alcohol, and chemicals that enter your body. It produces critical proteins that your blood needs to clot properly. It regulates hormone levels, including estrogen, testosterone, and cortisol. And it plays a central role in managing inflammation throughout your entire body. That last point is absolutely critical, inflammation management, because when your liver becomes sluggish, congested, or overloaded, which happens gradually and silently in millions of Americans due to poor diet, alcohol consumption, environmental toxins, processed foods, and certain medications, its ability to regulate inflammation breaks down. And when the liver can no longer properly filter and process inflammatory compounds in the blood, that inflammation spreads. It travels, it settles in the tissues and joints and muscles throughout your body. And one of the most common places it settles, backed by both traditional medicine and a growing body of modern research, is the lower back. Now let us talk about the anatomy of this connection, because this is where things get really fascinating. Your liver sits in the upper right quadrant of your abdomen. It is connected to your lower back through a complex network of fascial tissue, which is the connective tissue that wraps around and connects every organ and muscle in your body. When your liver becomes enlarged due to fatty liver disease, inflammation, or toxic overload, it physically puts pressure on the surrounding fascial tissue. That pressure travels through the fascial network and can directly create tension and pain in the muscles and soft tissues of the lower back. This is called referred pain, and it is a well-documented phenomenon in medicine where an organ or internal structure sends pain signals to a completely different part of the body. Additionally, the liver shares nerve pathways with the lower back through the autonomic nervous system. When the liver is under stress or inflammation, it sends distress signals through these shared nerve pathways that the brain sometimes interprets as originating from the lower back muscles rather than the liver itself. This is one of the key reasons why so many people with liver issues present with lower back pain as their primary complaint, and why so many of them spend years being treated for a back problem that was never actually a back problem at all. There is also the issue of toxin accumulation. When your liver is not functioning optimally, toxins and inflammatory compounds that should be filtered out of your bloodstream start to accumulate. These toxins, particularly advanced glycation end products and lipopolysaccharides from gut bacteria, are highly inflammatory. They circulate through your body and deposit in the soft tissues, muscles, and joints. The lower back muscles, which are already under constant mechanical stress just from supporting your body weight and movement, are particularly vulnerable to this inflammatory deposition. The result is chronic, persistent muscle inflammation in the lower back that no amount of stretching, massage, or physical therapy can fully resolve because the root cause is still circulating in your bloodstream every single day. Now I want to stop right here and share a story with you because everything we have been talking about becomes so much more real and meaningful when you see it happening in the life of a real person. Sandra is a 59-year-old retired nurse from Dallas, Texas. She spent 30 years on her feet caring for patients, so when her lower back pain started about 4 years ago, everyone, including her own doctors, assumed it was just occupational wear and tear. Completely logical assumption. She saw 4 different physicians. She went through months of physical therapy. She tried chiropractic adjustments twice a week for an entire year. She tried acupuncture. She tried 3 different prescription anti-inflammatory medications. She bought a new mattress that cost her over $2,000. She did yoga. She did stretching routines every single morning and evening, and nothing worked, not even close. The pain would ease slightly for a few days and then come roaring back, often waking her up at 3 or 4 in the morning and making it impossible for her to fall back asleep. What made Sandra's case particularly confusing was that her MRI showed only very minor degenerative changes in her lumbar spine, nothing that should have been causing the level of pain she was experiencing. Her doctors were stumped. They started suggesting that the pain might be psychological, that stress or anxiety might be amplifying her perception of pain. Sandra, a trained nurse herself, knew in her gut that something else was going on. She refused to accept that explanation and kept searching for answers. Then, about 2 years into her journey, she was referred to a functional medicine doctor in Dallas who took a completely different approach. Instead of focusing exclusively on her spine and musculoskeletal system, this doctor ran a comprehensive panel of labs that included detailed liver function tests, inflammatory markers, and a liver ultrasound. What they found changed everything. Sandra had non-alcoholic fatty liver disease, a condition where excess fat accumulates in the liver and causes chronic low-grade inflammation that had gone completely undetected during all of her previous medical evaluations. Her liver enzymes were elevated, her inflammatory markers were significantly above normal, and her liver ultrasound showed mild but clear enlargement. Her functional medicine doctor explained the liver and back pain connection to her, the fascial pressure, the shared nerve pathways, the systemic inflammation. And Sandra said it was like someone had finally turned a light on in a room that had been dark for years. Everything made sense. Her doctor put her on a comprehensive liver support protocol that included dietary changes, specific liver supporting supplements, increased hydration, and a gentle detoxification plan. 6 weeks later, Sandra's chronic lower back pain that had stolen her sleep, her quality of life, and her peace of mind for nearly 3 full years was reduced by more than 70%. 10 weeks after starting the protocol, she described herself as virtually pain-free for the first time in years. She told her daughter that she finally felt like herself again. Sandra now shares her story with everyone she knows who is struggling with unexplained chronic back pain because she wants them to ask the question that nobody asked her for 3 long years. How is your liver doing? Now let us talk about the warning signs that your liver may be contributing to your back pain because catching this early makes an enormous difference. The first and most important sign is lower back pain that is persistent, dull, and aching, particularly on the right side, that does not respond to the usual treatments and does not have a clear mechanical cause like a known injury or confirmed disc herniation. If your MRI or X-ray is relatively clean but your pain is severe and chronic, your liver deserves serious attention. Other signs that your liver may be struggling include persistent fatigue that does not improve with rest, bloating, and digestive discomfort, particularly after eating fatty meals, a yellowish tint to your skin or the whites of your eyes, dark urine, light-colored stools, frequent headaches, brain fog, and difficulty concentrating, skin problems like itching or unexplained rashes, pain or heaviness in the upper right abdomen, and unexplained weight gain, particularly around the midsection. You do not need to have all of these symptoms for your liver to be under stress. Many people with significant liver dysfunction feel relatively fine in terms of obvious symptoms, just like Sandra did, while their liver silently struggles and sends that distress signal to their lower back every single day. So what can you do about it? What are the most evidence-backed, practical, and accessible steps you can take starting today to support your liver and begin addressing this root cause of your chronic back pain? Let us go through them one by one. The first and most impactful step is to dramatically reduce your consumption of processed foods, refined sugars, and industrial seed oils like soybean oil, corn oil, and vegetable oil. These are the primary drivers of non-alcoholic fatty liver disease and liver inflammation in the American diet. Replace them with whole, unprocessed foods, fresh vegetables, fruits, lean proteins, legumes, and healthy fats like extra virgin olive oil and avocado. The second step is to increase your water intake significantly. Your liver needs adequate hydration to efficiently filter toxins and carry out its hundreds of daily functions. Most Americans are chronically mildly dehydrated, and this alone puts significant extra strain on the liver. Aim for at least 8 to 10 glasses of filtered water per day. Start every single morning with a large glass of warm water with fresh lemon juice. Lemon has been shown to stimulate bile production and support liver detoxification pathways. The third step is to incorporate liver-supporting foods into your diet every day. The most powerful ones include cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, and kale, which contain compounds called glucosinolates that directly support the liver's detoxification enzymes. Beets are extraordinarily powerful for liver health. They contain betalains and betaine, which protect liver cells and stimulate bile flow. Garlic contains allicin and selenium, both of which activate liver detoxification enzymes. Turmeric contains curcumin, one of the most well-researched anti-inflammatory compounds in the world, which has been shown in multiple studies to reduce liver inflammation and protect liver cells from damage. And green tea contains catechins, powerful antioxidants that have been shown in clinical studies to improve liver enzyme levels and reduce liver fat accumulation. The fourth step is to consider targeted liver-supporting supplements under the guidance of your healthcare provider. Milk thistle, specifically its active compound silymarin, is the most extensively researched natural liver supplement in the world, with hundreds of studies demonstrating its ability to protect liver cells, reduce inflammation, and support regeneration of damaged liver tissue. N-acetylcysteine, also known as NAC, is a powerful antioxidant that supports glutathione production, and glutathione is the liver's primary internal antioxidant and detoxification molecule. Dandelion root has been used for centuries as a liver tonic, and modern research supports its ability to increase bile production and support liver detoxification. Always discuss supplements with your doctor before starting them, particularly if you are taking any medications. The fifth step is to reduce alcohol consumption or eliminate it entirely if possible. Alcohol is one of the most directly damaging substances your liver processes, and even moderate regular consumption can contribute to liver inflammation and the cycle of chronic back pain we have been discussing. This is not about judgment. It is simply about understanding what your liver is dealing with every day and giving it the best possible chance to function optimally. The sixth step is to get tested. If you have chronic lower back pain that has not responded to conventional treatment, ask your doctor to run a comprehensive liver function panel including ALT, AST, GGT, alkaline phosphatase, and bilirubin levels. Ask for an inflammatory marker panel including CRP and ESR, and if indicated, ask for a liver ultrasound. These are standard, accessible, and relatively inexpensive tests that can reveal whether your liver is playing a role in your pain, and having that information is the first and most important step toward actually fixing the problem rather than just managing symptoms indefinitely. The bottom line is this: chronic lower back pain is one of the most common and most debilitating health complaints in America, and the current medical approach, which focuses almost exclusively on the spine, the muscles, and the structural components of the back, is failing millions of people like Sandra every single year. The liver and back pain connection is real, it is documented, it is physiologically sound, and it is something that every single person dealing with unexplained chronic back pain deserves to know about and discuss with their healthcare provider. You should not have to suffer for years before someone asks the right question. And now that you know, you can ask that question yourself. Do not let another morning go by waking up in pain that nobody can explain. Talk to your doctor, get your liver tested, start making the dietary and lifestyle changes that support your liver health, and give your body the real chance it deserves to heal from the inside out. Now, before you go, I want you to do one thing right now. Drop a comment below and tell me your age and the city you are watching from. And tell me, Have you ever been told your back pain might be connected to your liver? Have you ever had your liver tested as part of your back pain evaluation? I want to hear your story. I read every single comment in this community, and your experience might help someone else who is watching right now. And if this video opened your eyes, please share it immediately with someone you know who has been struggling with chronic back pain that nobody can figure out. This information could genuinely change their life. Hit that subscribe button, turn on the notification bell, and I will see you in the next video. Take care of your liver, because it might just be the key to finally taking care of your back. This video is created strictly for educational and informational purposes only. It does not constitute medical advice, medical diagnosis, or any form of treatment recommendation whatsoever. The information shared in this video is based on publicly available scientific research, peer-reviewed studies, anatomical knowledge, and general wellness information available at the time of recording. The patient story featuring Sandra has been included solely for illustrative purposes to reflect real-world experiences consistent with existing medical and functional medicine research. Individual results will always vary significantly based on age, overall health, underlying medical conditions, lifestyle factors, and other personal circumstances. Any connection between liver health and back pain discussed in this video should be evaluated by a qualified and licensed healthcare professional in the context of your specific medical history. Never attempt to self-diagnose or self-treat any medical condition based on content you have watched online. Always consult with a board-certified physician, gastroenterologist, hepatologist, or other qualified medical professional before making any changes to your diet, supplement routine, or health protocol. The creator of this channel is not a licensed medical professional. No statements in this video have been evaluated or approved by the United States Food and Drug Administration. No food, supplement, or lifestyle recommendation mentioned in this video is intended to diagnose, treat, cure, or prevent any disease or medical condition. If you are experiencing severe or worsening back pain, abdominal pain, or any concerning symptoms, please seek immediate medical attention from a qualified healthcare provider. Viewer discretion is always advised.